All right, Sandro. Great job on your first at-home virtual telehealth session.
Thank you.
Tell me a little bit about your experience.
It was great. It was super helpful. You made me feel comfortable, and you were very explicit with your directions, which is helpful because obviously you can't physically touch me and tell me where to put pressure and stuff. So I appreciate the details and like the preciseness in how you explained what to do. That was very helpful.
So right there, and then rock forward as far as you can, and then come on back. So what it's doing is driving the main ankle bone back. So we would normally, like in person, we'd be normally using our hands to do it, but this is a good way for you to kind of self-mobilize on your own. Okay, perfect. What were some of the advantages to doing this at home versus having to come into our office?
I mean, obviously, a very timely advantage. I don't have to worry about you know quarantines and coronavirus.
Right.
But I think another advantage is like I'm naturally comfortable here.
Mhm.
Um, and it was easy for me to like set up I mean, I figured I was going to be moving around and stuff, so it's like nice to be able to set up a space that worked for me.
Right.
Um, and I guess you'd obviously have straps and stuff at your place, but I think being able to use my own stuff, like I don't have to figure out how to do the exercises at home. Like,
Mhm.
because sometimes when you go into a gym and they'll tell you to use all this equipment that you don't have, it's not helpful. But using stuff I already had was helpful because now I know I can definitely do the exercises at home.
All right. Perfect. Do you feel like even though I couldn't actually touch you with my hands, I was still able to give you the right cues and instructions?
Yeah, yeah. Definitely going back to the original comment. Um, you are because like I mean I don't know, like you were telling me to touch my legs and feet in ways that like I would never do naturally.
Right.
But you know, the way you gave the instructions was super helpful, and you also gave me like cues to look for, like you should feel it here, you should feel it there.
Mm,
So that helped me know if I was on the right track or not.
okay. Um, if someone was on the fence about doing a virtual home session, what would you tell them?
I would ask them what their concerns are, but
Mhm.
um, I I don't think I would probably just tell them like you can probably get the same out of it as long as you can listen to instructions and follow
Right.
them. Um, but given that your instructions were so clear, I think you can get the same out of it. You can take it from home, which is probably even in normal times a little easier to schedule something because this was an hour session and I only needed exactly an hour to do it. Like I didn't need to drive anywhere and drive back. So it's really easy to fit into your schedule. Yeah, I think it's for things like this that seem to. I mean, I don't know much about this obviously, but this wasn't like a serious injury. Like I don't think it made any difference whether I was in person or we did the virtual.
Yeah, and I think for us, and as we transition to, we have to keep up with the times and we have to keep up with the needs of our clients, right? If they're not able to come out, we still have to help. So even us personally, we've had to improve our communication, improve our cueing, because we're essentially kind of teaching you how to be the clinician, right?
Right.
So it's funny, like a lot of people that we've worked with so far, they're like, um, they're a lot better with their hands now. They're understanding things because sometimes when I just use my hands, I just do it and you feel better,
Right.
right?
Exactly. And you don't think about it.
And you don't really have to think about it. You feel better. But now it's like, okay, if you do this, it feels better. So this is why this specific exercise with your band or with the ball or whatnot is like uber imperative for this to work for you. So, that's kind of where we're going with this, to not only help you guys, but educate you guys at the same time. So, um, appreciate your time, man.
Yeah,
Uh,
of course.